Our next testifier is Zachary Shamberg, the President and Chief Executive Officer of the Pennsylvania Healthcare Association. Thank you, sir.
Thank you.
We're running a little behind schedule, but
I was afraid you were going to say that.
but we.
It's the universal cue for me to be quick with my testimony today.
But we've had a great discussion today, and we look forward to your testimony.
Thank you. Chairman Kauser, Representative Mahaffey, Congressman Heffley, thank you for being here from D.C. Members of the House Republican Policy Committee, good afternoon, and thank you again for the opportunity to participate in today's hearing. I am Zach Shamberg. I'm the President and CEO of the Pennsylvania Healthcare Association, better known as PHCA. And Mr. Chairman, as an aside, I have a 3-week-old daughter at home who has decided she doesn't want to sleep anymore at night. So I am formally proposing a series of these hearings, preferably in Erie or Southwest Pennsylvania, that would require a hotel stay for all the testifiers, and we'll participate.
As a matter of fact, we're planning others.
Perfect.
So.
Perfect. A little bit about PHCA. We represent long-term care in Pennsylvania. That includes nursing homes, personal care homes, and assisted living communities. That's the front lines of the COVID-19 pandemic. We represent the providers, the residents they serve, and the workers, nearly 150,000 brave men and women. But that number is dwindling, and obviously that's why we're here today. To give you a bit of background, just 2 months ago in mid-September, we conducted a survey of our members to better understand their challenges on the front lines. And we asked about many different issues. But as we began to receive responses to our questions, it became very clear to us that we needed to sound the alarm on the crisis that was affecting long-term care. And that crisis, of course, is the shortage of our workers. Quite simply, we don't have enough frontline workers to care for our aging population today, let alone in the years to come as that aging population grows. This was an issue prior to the pandemic, as we've heard already today. In 2019, our then Auditor General actually published a report about it, and it was called "Who Will Care for Mom and Dad?" But the past 2 years and the pandemic have exacerbated and accelerated this shortage. Our September survey revealed a nearly 20% loss in the long-term care workforce during the first 18 months of the pandemic. That's tens of thousands of staff members gone. The majority of our nursing home providers told us they currently have more than 20 open positions that they can't fill. Nearly 70% of facility respondents said they were having trouble meeting minimum staffing requirements, let alone a proposed regulatory change to move to the highest staffing minimum in the entire country. And there is a growing reliance, as you've heard loud and clear today, on agency or contract staff that is pushing many providers to the brink of financial collapse. So why should this matter to you and to the rest of Pennsylvania? Because we do have an access to care issue now in one of the oldest states in terms of our population in the entire country. As legislators, you're likely hearing about workforce shortages every day, not just in healthcare, but in every industry. But what you probably haven't heard, and what I'd like to tell you today, is that long-term care providers throughout the state are now in a position where they are turning away vulnerable senior citizens, your constituents, who require care. In September, nearly 75% of our members revealed to us that they were restricting new admissions as a proactive measure to maintain care for their current residents. So we had to dig into that. And when we asked, what does restricting admissions really mean? One provider told us that they had declined 80% of all hospital referrals simply because they didn't have enough staff. So why can't we seem to recruit and then retain our workforce? Because long-term care providers simply cannot compete in today's wage market. For nursing homes, more than 80% of all resident care is paid for by Medicaid and Medicare. That's government-allocated funding. More than 70% is just Medicaid alone. But that Medicaid reimbursement rate for care hasn't kept pace with rising costs, and it hasn't been increased since 2014. As a result, our members were operating at negative 2.4% margins prior to the pandemic. So you can imagine what that number looks like today. And these are the same providers, and this has ensured that those same providers won't be able to invest in their workers with higher wages, with bonuses, incentives, and benefits. This crisis is not going to go away overnight. I think we've realized that today. In fact, we anticipate that it could get worse if the impending federal vaccine mandate, which we've touched on already, is implemented. But we believe there are 4 key ways in which you and your colleagues can help. First, as these challenges continue, we will need assistance to supplement our workforce. And I'll be very honest, that may need to come from the National Guard. We have already asked state regulators to consider this plan, as was done last year. We may need your support too. Second, with federal stimulus dollars still available, this morning, we asked both the governor and the Department of Health to help us temporarily stabilize our workforce by allocating American Rescue Plan funds to providers so that they can offer employee retention bonuses and hopefully deter more departures. Other states have done this with great success already. Third, think outside of the box with us to help find legislative solutions, especially around breaking down regulatory barriers. Lastly, and most importantly, we need the General Assembly to make a meaningful investment in long-term care in 2022, and that is an increase to the Medicaid reimbursement rate. That funding will allow providers to truly invest in not only their workforce, but in the infrastructure needed to support our senior citizens in Pennsylvania. Again, I want to thank you for this opportunity, and I'm very happy to answer questions now.
Thank you very much for your testimony. And to the 4 specific points that you made and support that we will take a look at, using American Rescue Funds for long-term care agencies. And you stated that you made a request to the governor. Can you share how much funding you think that would be necessary to really assist our long-term care facilities?
Of course. So this morning we requested $200 million from the American Rescue Plan funds to go directly to nursing home providers, assisted living communities, and personal care homes. Those dollars would be sent directly to workers, both full-time and part-time, to offer retention bonuses. We estimate for every single full-time and part-time worker, that would mean a $1,200 retention bonus. And again, this is anything to ensure that providers or that workers will remain on the front lines.
Thank you for that. And you mentioned a request or the idea of having the National Guard help our facilities. Can you expand on that a little bit and what role you think they could help these facilities with?
Well, we saw this in Pennsylvania and in our long-term care facilities throughout 2020, where we called on the National Guard to come and help us just supplement the loss in our workforce. We recently saw this about a month ago in the Berks County nursing home that called on the state and the National Guard to come in and again supplement their workforce. We've talked a lot about the impending federal vaccine mandate. I mentioned it in my testimony. I would encourage you to watch what's happening right now in New York State, where New York's governor has called on the National Guard, and they have the National Guard ready. If this vaccine mandate goes into place and if their workforce continues to be diminished or to decrease, that they'll need the National Guard just to come in to maintain patient care. And that is something that we need to be prepared to do. You know, the mandates that are introduced, some of the regulatory challenges that we've had, we've been clear from the beginning, from the very beginning of the pandemic. If these mandates and if these challenges are going to remain or going to continue, we need to be prepared to ensure that care can continue. And we need to be prepared to ensure we've got a plan in place as a Commonwealth to ensure that staffing is available for long-term care.
Thank you very much. Additional questions from members? Representative Heffley?
My last time for today, I promise. Yeah, right. So I've heard from long-term care providers throughout my district, echoing exactly your testimony today. Some 30% of their beds are empty because they don't have the staff to do that. And if the mandates go through, they could lose up to 10% more of their staff. And I think, as I mentioned to the last testifier from HAP, there needs to be flexibility. Unfortunately, these mandates come down from the top, and I don't think they really have any comprehension of what it does or understanding what it does to the people that need these services the most. I mean, I have families that are taking care of elderly parents or grandparents that have onset of dementia or Alzheimer's, and they just simply cannot do that any longer. And they cannot find a location that can take them. So I think in short term, is it the National Guard? I don't think that's a long-term solution in any way at all. So I definitely think there is a need. I think obviously looking at additional funding for retention. Can that help? But also, I mean, you look at the cost of everything. Inflation's going up, whether the cost of heating the room for those patients. Obviously, we're seeing record high energy costs that don't make any sense. But, I mean, the fact that bad policies drive high energy costs, bad policies driving high fuel costs, bad policies are driving people out of this. And at the end of the day, the folks that are suffering are the people that need these services the most. So I certainly look forward to working with you and solutions. I appreciate your members contacting the legislatures. I've learned a lot in those conversations with those providers of what their needs are. And these are people that are genuinely, compassionate and concerning. They're in this profession because they really want to care for people. They have a true drive to make these folks' lives better. So I would appreciate your advocacy, and we'll continue to work with you to help them out. Thank you.
Thank you.
Representative Zimmerman.
Thank you, Mr. Chairman. Thank you, Zach, for your testimony. Quick question. You mentioned regulatory barriers. Can you give me one or two that are most erroneous?
Yeah, so Representative, that's a great question. And actually, the first request that we made of the governor and the Department of Health back in March 2020 was to ease some of those regulatory barriers or just some of those regulatory challenges that our industry faces, especially around bringing in more staff. So I'll give you 2 or 3 good examples. One, allowing retired workers or those workers whose licenses have lapsed to allow them to come back and serve on the front lines without jumping through 6 to 8 months of regulatory hoops. So we've heard loud and clear today, it shouldn't be that difficult to be able to bring folks back or bring folks into this industry or healthcare in the first place. One of the other requests we made was allowing workers in our facilities with abbreviated training to take on different roles, really to be utility players. And again, we heard earlier, we need to be creative when it comes to filling these staffing gaps. One of the things I'll mention is that last year, you supported legislation that ultimately became law that would allow a brand new type of position, a temporary nurse aide position, would allow those folks to transition to CNAs or certified nurse aides, to be full-time nurses. That was a very creative solution at the height of the pandemic, and we need to think outside of the box like that moving forward.
Good points. Thank you. Thank you, Zach. Thank you, Mr. Chairman.
Representative Nelson.
Thank you, Mr. Chair. Zach, thank you for your testimony. I'm kind of following up on some of the regulatory barriers from Representative Zimmerman. I remember in the past there was testimony that some of the reporting, the daily reporting redundancy, and the amount of paperwork that is eating up staff time. Has there been any accomplishments or relief in that area from a reporting requirement as we're looking at 2020?
Yeah, great question, Representative. Thank you. And you heard Jeff in the previous on the previous panel talk about the push for patients over paperwork, and that's the way it should be. But certainly, as we've seen in long-term care, which is the second most regulated industry in the entire nation, if you can believe it, that has essentially been flipped on its head, and it's really been paperwork over patients. Now, we have, throughout the pandemic, insisted with any kind of data collection or reporting that there be one reporting source and one data source that can be pulled from by state and federal officials. And unfortunately, in March, April, May, or June of 2020, we had providers reporting up to 7 or 8 or into up to 7 or 8 different data sources. So you can imagine why data that was reported was incorrect or was muddled, jumbled. Now, Representative, I am pleased to report to you that we are down to one report that can be pulled from at both the state and federal level. I would caution, however, that last week we saw a steep decline in vaccination data from a state perspective, 73% down to 68% just in one day. So while reporting has certainly been improved, we're still seeing numbers like that would caution me and caution our industry that we've really got to stay on top of that issue and ensure for families, for residents, for workers, for the general population that we're reporting accurate data throughout Pennsylvania.
That's great, and it's good to hear at least we're moving forward in some of those areas. The second part that you had testified in the area of reimbursement, like some of those 2021 American Rescue Plan dollars that you mentioned for the cost of testing and additional PPE reimbursements. Have there been some, American Rescue Plan dollars within 2021 allocated to help bridge some of that gaps for your senior facilities?
Yes, Representative, and again, thank you for that question. During the state budget process, this legislature allocated $277 million from the American Rescue Plan specifically to long-term care. $247 million went to nursing homes, $30 million went to assisted living and personal care, and that was really to supplement COVID-19 related costs like testing, PPE, and those staffing shortages. When we talk about certainly Medicaid in 2022, the last 2 years have really been about survival for long-term care. We have to look at sustainability in the years ahead to ensure that we can care for our aging population.
Great, thank you. Thank you, Mr. Chair, and look forward to working with you in that 2022.
Thank you, Representative Nelson. Representative Mahaffey.
Since it was brought up, and I have House Bill 106 along with Representative Tomlinson, we talk about some staffing standards that are out there. I know there was some goings on with DOH, and you guys had some public comment, and you guys were opposed to the 4-to-1 in the ratios and so forth. To meet that, though, what do you guys really need? I mean, I get the money part, and you can throw a lot of money at it, but at the same time, these American Rescue dollars are going to run out, and this is a long term. This is not a sprint. This is definitely a marathon, and you guys have had a lot of problems with reimbursement anyway. With low reimbursement, you can't pay the staff that you need. So beyond that, do you have any ideas of what you want to do other than the American Rescue dollars, how we can, as the General Assembly, see these needs met as far as standards and some of the other things that are needed for you?
Yeah, thanks for your question, Representative. And I want to be clear, when it comes to the Department of Health's proposed staffing regulation, that's what you're asking about. So it's interesting because when we talk to our providers on the ground about it, and we say, if the state were to fund every single dollar of this proposal, would that make it feasible for you? The immediate response is, where do I find the workers? And I think to do this, to jump from 2.7 to 4.1 immediately, forget about the funding, to your point. We've heard a lot today about building the workforce pipeline and finding ways to bring more workers to long-term care, to healthcare, not just today, but in the years ahead. That's got to be a first consideration before we look to raise staffing standards and implement them immediately. So it's education, it's creative solutions to, again, bring more folks to the workforce right now. We need to explore those kinds of opportunities and really address those sorts of challenges before we as an industry can get to that place where we're ready to accept or work with a higher staffing standard. And I also want to say, there's not a single long-term care provider in this state who isn't actively looking to hire more workers right now or to raise their staffing levels right now. But it takes funding and it takes those available workers.
You quickly, you mentioned that some of your facilities cannot accept like 80%, what was it, 80%?
Yeah, we had one provider in the Pittsburgh area who told us they had turned away 80% of hospital referrals because they didn't have enough staff to care for those new residents.
But that means then that those folks stay in the hospital.
That's correct.
Okay.
Well, they stay in the hospital or they go home. And if they're not ready for home care, if they can't stay at that hospital, I think the question was asked earlier, then where do they go? If they need 24/7 care in a nursing home, but they don't go to a nursing home or one of our assisted living or personal care communities, they're not going to get the care that they need and the care that they deserve.
Okay, very good, thank you.
Zach, thank you very much for your
Thank you.
testimony. We appreciate you being here with us and sharing that with us.